In the last video, we talked about benzodiazepine. I told in that video that barbiturates are not commonly used nowadays because due to toxic effect. What is the reason for the toxic effect? Both benzodiazepine and barbiturates, there are several levels according to dose that we could divide. First one is sedation and anxiolysis, that is for the lower dose. Next, hypnosis. Next, anesthesia. Next, medullary depression. Next, last effect is coma. Why don't we use barbiturate most commonly is, as you can see that I have drawn a line that shows in the same dose when benzodiazepine is causing anesthetic effect, barbiturates will cause coma. Barbiturates will cause coma. So even the slow dose, it will cause more unwanted effects, and we tell this, or we introduce this scenario as narrow therapeutic window. If someone asks why barbiturates are not commonly used, because they have narrow therapeutic window compared to benzodiazepine. How to remember barbiturates is mnemonic is patients present more in 6 seconds. P means phenobarbital. You will see that there is phenobarbital as well. There's no difference barbital or barbiton. So same thing they are talking about. P phenobarbital, M methyl phenobarbital, 6, you know 6 is hexano. So hexobarbital, seco seconds, secobarbital. Those are the drugs. If you remember these 4 drugs, it will be more than enough for examples of barbiturates. Mechanism of action: enhance and mimic the action of GABA receptor complex, hence increasing opening of chloride channel. Same like mechanism of benzodiazepine. Indication: they also could use in antiepileptic medication. Mainly the drug we use for antiepileptic is phenobarbital. Nowadays not commonly used, but there are some researches going on that we could use phenobarbital. They could use, they are more effective, but due to some side effects, we don't use much phenobarbital nowadays. But still they are going some researchers, even though those side effects are there, they are the best drugs. And for free anesthetic, anxiety, insomnia, cerebral ischemia, and cerebral edema. Side effects same as benzodiazepine, but has poisoning. Even though I told this is same as benzodiazepine, there are more effective, more withdrawal symptoms, more physical and psychological dependence, more tolerance compared to benzodiazepine. In last video we talked that why benzodiazepine are good, because they have less dependence, less withdrawal symptoms, less psychological and physiological dependence. So compared to benzodiazepine, in barbiturates that is more due to their narrow therapeutic window. Phenobarbital poisoning, even though 6 to 10 gram is toxic. 6 to 10 gram is toxic. So what should you do if phenobarbital poisoning is happened? First, you have to do gastric lavage and introduce charcoal into stomach to absorb those poison. Next, you could do hemodialysis and oxygen supplementation and artificial ventilation, because they will decrease the respiratory rate.